KŌKUA is the native Hawaiian word for help. Its deeper meaning is to extend help in a sacrificial way with no interest in personal gain. It is this value that we hope to embody in our project and impart to others. Our project title uses the word KŌKUA as an acronym for Kupuna outcomes and knowledge in underserved areas. Our ultimate vision is to change mindsets, attitudes, and knowledge in rural primary healthcare to prepare the existing primary care system and to create new leaders to tackle the needs of our vulnerable kupuna or elderly. We cannot create enough new geriatric healthcare professionals in time to meet the needs of the impending boom of the elderly population. We are tackling the wicked problem of Hawaii's geriatric workforce shortage and the inverse growth in the elderly population. The state of Hawaii is not well equipped to care for our kupuna. We have a severe shortage of medical and mental health providers. Due to our unique geography, this deficit is especially felt in low-income populations and on the neighbor islands. Most specialists are clustered around the state capital of Honolulu on the island of Oahu. Hawaii Island compares more poorly to the rest of the state, struggling with a greater shortage of primary care providers, pharmacists, and mental health professionals. This shortage has become so drastic that it is a public health emergency. Service providers frequently work in silos, causing a lack of coordination for healthcare services for older adults. Currently, the only formal geriatric medical training entity is at the University of Hawaii, with the educators again mostly located on Oahu. To accomplish this task, we have developed a geriatric training framework based on the John A. Hartford Foundation and the Institute for Healthcare Improvement's 5 M's, using teleeducation for Hawaii Island Family Medicine Residency Program to strengthen the front line of our primary care workforce. The 5 M's is a distillation of the most important topics when working with the geriatric population: what matters, mind, mobility, medication, and multi-complexity. We are breaking down the silos in the current healthcare professional workforce and closing the knowledge gap to create empowered, synergistic primary care clinicians who will be future leaders and advocates in elderly care. This approach has been successful to date. We have completed 5 modules of a 16-module curriculum across 2 years. This curriculum includes practice-based interdisciplinary activities, curbside consultation on real-life cases, case-based learning, and the integration of decision-making tools. Secondly, we plan to improve outcomes in the geriatric core measures in the clinic's elderly patients. We are currently working towards recognition as a Level 1 IHI age-friendly healthcare system, as well as designing the Kupuna Collaborative Care Plan, or KCCP. This is an individualized action plan based on the 5 M's. Lastly, we are focused on the dissemination of resources and materials through the KŌKUA project website. This site will be an online repository of training materials and resources, creating a geriatric-friendly network across the state of Hawaii. In the long term, by supporting community medical and mental health care professionals, we hope to improve provider satisfaction with their roles in rural healthcare. This would reduce clinician burnout and turnover, keeping invaluable members engaged and committed to their community. Ultimately, we hope that the lessons learned from this project will be useful in the creation of new programs in similar underserved communities, aiming to create age-friendly healthcare systems to uplift the care of the elderly. For more information, please visit our website, thekokuaproject.com, or contact us at teamkokuaproject@gmail.com. Mahalo for your attention.